Mesothelioma is an aggressive type of cancer that develops from the mesothelium, which is a protective lining that covers many of the internal organs of the body. The mesothelium lines the lung, chest wall, abdomen, and heart. Most cases of mesothelioma are caused by exposure to asbestos. The survival rate for mesothelioma is low compared to many other types of cancer. According to published statistics, only 10 to 15% of mesothelioma patients will survive beyond 5 years after initial diagnosis. Unfortunately, mesothelioma is usually not diagnosed until it has reached an advanced stage, contributing to the low survival rates. The stage of the cancer at diagnosis is the most important factor that determines prognosis. For stage I mesothelioma patients, who have a tumor identified within the lung lining or abdomen but that has not spread to the lymph nodes or other areas, the median survival time is approximately 36 months. Stage 2 mesothelioma is slightly more advanced, with the tumor having grown into surrounding tissues but not yet spread to distant sites. For stage 2, median survival is around 22 months. Stage 3 is more widespread involvement of the chest wall structures or diaphragm muscles, or lymph node involvement. Median survival is around 14 months in stage 3. Stage 4 mesothelioma has spread to other parts of the body and has a grim median survival rate of only around 12 months. The three main treatment options for mesothelioma are surgery, chemotherapy, and radiation therapy. Some patients undergo surgery known as extrapleural pneumonectomy, which removes one entire lung and the linings of the lung and chest wall that were affected by the cancer. However, surgery often has limited benefits for advanced stage mesothelioma. Chemotherapy drugs such as pemetrexed, cisplatin, or carboplatin are usually part of initial treatment. Radiation is sometimes used after chemotherapy to treat any remaining cancer cells. For localized, resectable mesothelioma caught at stage I, aggressive treatment with surgery followed by chemotherapy and radiation can potentially provide long-term survival, with some patients reportedly surviving over 10 years post-treatment. However, even with a multimodality approach, the 5-year survival rate remains low, at only around 35 to 40% for resectable stage I disease. For later stage 2-4 mesothelioma, 5-year survival plummets to just 5 to 10%. Now let's examine ovarian cancer survival rates. Ovarian cancer is the 8th most common cancer in women worldwide and the 5th leading cause of cancer deaths among women in the United States. As with mesothelioma, the stage at diagnosis significantly impacts the prognosis and survival outcomes. For stage I ovarian cancer that is confined to one or both ovaries, the 5-year survival rate is approximately 92%. Surgery is usually very successful at completely removing stage I disease, leading to high cure rates. Stage 2 ovarian cancer has spread from the ovaries into the pelvis but not beyond. The 5-year survival rate decreases to approximately 72% for stage 2 disease. Stage 3 consists of tumors that have spread beyond the pelvis into the lining of the abdomen or lymph nodes in the abdomen. The 5-year survival rate for stage 3 ovarian cancer is approximately 34%. For the advanced stage 4 disease where cancer cells have spread to distant organs outside of the abdominal cavity such as the liver or lungs, the 5-year survival rate drops to only around 19%. Initial treatment for ovarian cancer involves surgery to remove as much of the tumor as possible. If cancer is only located in one or both ovaries, a total hysterectomy, removal of ovaries and uterus, may be sufficient. For later stage disease, extensive surgery is required to remove all visible cancer tumors in the abdomen. This often includes the omentum, pelvic and abdominal lymph nodes, appendix, spleen, and parts of the intestine. Following surgery, treatment often involves a combination of platinum-based chemotherapy agents such as carboplatin or cisplatin alongside paclitaxel. For some women with later stage disease, additional chemotherapy may be provided beyond initial treatment to help control symptoms and reduce the risk of recurrence. Targeted therapy drugs and immunotherapy are also potential additional options depending on the specific situation. While early-stage diagnosis provides the best chances of long-term survival, ovarian cancer survival rates remain relatively high even for stage 2 disease at over 70%. However, mesothelioma outcomes are unfortunately much poorer overall, with only a minority of patients surviving beyond 5 years. Aggressive multimodal approaches and clinical trials exploring new therapies continue to be important areas of focus to help improve mesothelioma and ovarian cancer survival in the future.